We now have a rare, honest assessment from the President of the United States. You remember not long ago he said the virus was dying out. Now he acknowledges things are likely to get worse before they get better. And the President now belatedly joining the call for Americans to wear masks. The President's new tone is a reflection of two sets of data: his horrible re-election polling and the brutal coronavirus reality. The United States has added 903,000 infections in just 2 weeks. That is a stunning number anyway, but all the more sobering when we remember the important lesson of the past 5 months. When case numbers rise, other sad statistics follow. And already coronavirus deaths are again rising. You see there 1,082 recorded on Tuesday, yesterday. Also up hospitalizations, which now stand 222 shy of the pandemic peak. Some states say they have no beds and that supplies are dwindling, with cases rising and hospitals crowded. Many states and school districts now debating whether it's best to keep children at home for school, at least for a while. The CDC director this morning invoking his grandchildren and making the case he believes back to the classroom is safe for most of America.
Would you be comfortable with your school-aged grandchildren going back to school in the fall?
Absolutely. Absolutely. The only one that there may be some reservation is my grandson with cystic fibrosis, depending on how he can be accommodated in the school that he's in. But my other 10 grandchildren, of those, 8 of them are school age. I'm 100% that they can get back to school.
You're having that debate in your community. Let's catch up on where things stand today, state by state. We'll just start with the trend map, and you see a lot of orange, but 26 states. It was higher just a few days ago. We were at 38 states. 26 states heading in the wrong direction, meaning their new cases in the past week are higher this week than they were a week ago. 26 states in orange on the map heading up. 20 states holding steady, including, importantly, the state of Florida and the state of California. They have been 2 states on the leading edge, if you will, of this summer surge. We have 4 states going down. That includes Arizona. Again, good news in Arizona. Still a stubborn case count, but heading down after several troubled weeks there. Let's hope that continues. 26 states going up. If you look at the new cases, this is the troublesome part of the summer surge. A flat line from March into April, May, into early June. Now we go up, and here's the question on Wednesday, right? This is a 7-day moving average of cases. It has been troubling in recent days, 7-day average. You see that? Will it plateau? Will it plateau, and can we at least flatten and plateau at around 60,000 and then start to shove it down? That is the challenge of the next few days as we watch the case count. The top 5 states, California, Florida, Texas, Arizona, and Georgia. California way ahead of the other states. Florida not too far behind. You see Arizona still in the top 5, even though its case is now going down compared to last week. That tells you how tough the summer has been for the state of Arizona. California now has the dubious distinction of being the state with the most confirmed cases in the United States, just passing the state of New York. And you see how it played out. Back in June, on June 1st, shy of 115,000 confirmed infections in California, now approaching 410,000 as of yesterday. That number likely to pass 410,000 today. You see the steady climb in the state of California. 2 different paths these 2 states took. New York went up fast. Remember, back in March and April. Now it has plateaued. California was down for a long time, but now in the Los Angeles area, the case count driving it up. California, one of the summer surge examples, but there are many, leading the nation's top infectious disease expert, Anthony Fauci, to say just a short time ago, this fight, don't think of it as being anywhere near over. It is very much in the beginning.
We are certainly not at the end of the game. I'm not even sure we're halfway through. We are living right now through a historic pandemic outbreak. And we are right now in a situation where we do not see any particular end in sight.
Joining us now is Dr. Amy Compton Phillips. She's the Chief Clinical Officer for Providence St. Joseph Health. Doctor, thank you so much for being with us. When you listen to Dr. Fauci, when you see the case count, I have been proven wrong before, but you try to be an optimist when you see that maybe that summer surge is starting to plateau a little bit. Where do you see the country right now?
Where I see the country right now is exactly what Dr. Fauci was talking about, is maybe we're at the end of the beginning, I hope, of this surge. The fact that now the president is saying we need universal masking is hugely helpful, because that is the best tool we have to actually get things under control, stop particularly that asymptomatic spread that we know is driving so much of this.
And so I just want to look through some of the stats and get your input. First, just the positivity trend in the United States right now. And if you watch this, we are doing more testing. And you see from May, it starts to dip down, meaning the percent of the tests coming back positive. That's a good thing. That means there's less spread in your community. Now the national average up around 8%. But I want to take you inside just the state of Florida. If you had a national average of 8%, now let's look at Florida. It was 3.5% in May. 10.5% coming back positive in June, now approaching 20% in July. Explain why that is so important, and in the case of the 18.7%, so troubling.
So the way I think about it is it's a lot like if you had cancer. If you had a tumor and we cut the tumor out, we always look at the margins. We always look at the cells left behind, right? So if you had a tumor taken out and 0% of the margins had cancer cells in it, you know you got the whole thing. You've got it under control. If, on the other hand, 18.7% of the edges of that tumor had cancer cells in it, you know that that cancer had escaped and it was at risk for metastasizing around the body. And that's exactly what happens with the coronavirus. If we're not containing it, if we're not actually capturing all the cases, we know that it's out there and it's spreading further.
And so you mentioned masking. I just want to do a little, well, we'll have the conversation about what it's about on the other side. First, let's go back. This is the president back in April. Listen.
I just don't use them.
An example.
They're not mandatory guidelines. They're guidelines. They suggest you could wear them, you don't have to wear them. But basically, it's a voluntary thing.
It's a voluntary thing was then, and this is now, just yesterday, a very different message from the President of the United States.
When you get to 6 or 7 days, that kind of really mitigates against getting a good.
Just wear a mask, get a mask. Whether you like the mask or not, they have an impact, they'll have an effect, and we need everything we can get.
Apologies for the Fauci in the middle there, but the president there, he's reading from notes, so some people will say, does he really mean it? But at least he finally stood at the podium and said, why is that so important?
It's so important because of the fact that many people are able to spread the virus without realizing they have it, that they have 0 symptoms or they haven't developed symptoms yet. And because of that, because people simply don't know that they can be spreaders, they're not taking the normal precautions, right? So that if you wear the mask, we can dramatically interrupt, particularly the super spreading events that we know drive a huge percentage of the increased case counts. And by the way, I never object to hearing Dr. Fauci, so that didn't bother me one bit.
I appreciate that. It was a little technical issue on our part, but I appreciate your patience with it. I want to show, I use this because again, I showed you the numbers, the national numbers right now, and there's the potential for a plateau, up around 60,000 cases a week. That's not so great, but there's a potential for the plateau. But I just want to show this comparison to our viewers, the United States versus the European Union, because the European Union went up the hill before the United States, then it came down, you see, and it has stayed down. It has kept not only flattened the curve, but stayed at a low case level. The United States had a plateau through May and early June there, and then bam, back up. Why? Why is it so different? Roughly the same population. I know we have a different political system, obviously, but why is it so different?
There's a few things that the European Union did differently, and one is that they had very consistent, coherent messaging, that they led with the science, and that they didn't politicize the implications of what we need to do to control. They also paced out their reopening on the data rather than on saying that we have to reopen, full damn the torpedoes, full speed ahead kind of concept. And so I think that the fact that they had a little more cohesion around let's let the data drive what we're doing rather than work off of hope that they had a better outcome.
Hope, good word. Dr. Amy Compton Phillips, as always, appreciate your expertise and your insights and your time today. Thank you so much.
Thank you.